Hi, this is Elliot Fishman, and welcome to our CTisus quiz. It's October. This is that third Thursday in October. I have 10 cases for you. Let's get started. Okay, back pain. Look at this complex cystic lesion tracking from right to left. On arterial phase imaging, its water density has thin septations. You could think about a pancreatic cystic lesion perhaps, but when you look at all the images, it's separate from but comes near the head of the pancreas and near bowel. It's really in the mesentery. So what are you dealing with? You're dealing with a mesenteric mass with cystic and septations pushing but not invading the vessel. Very unusual tumor. It's not a cyst, but it's kind of septated. It's going to be a lymphangioma. Mesenteric lymphangiomas are rare, but they do occur. They're benign lesions, often displaced structures, can cause abdominal pain. A really great study. Right lower quadrant pain. We see thickening of the patient's right colon, particularly the cecum. You can see the entire right colon there, really thickened. And you could say to yourself, what could this be? Could it be a colon cancer? That would be a good thought. Could be inflammatory bowel disease. That would be a good thought. But you know what happens sometimes, and IBD would be a good thought, colon cancer, this appearance, this circular appearance with thickening, and there's a node there, can also be seen in ischemia. This was an unusual case of ischemic bowel, ischemic colitis. Prominent circumferential thickening. Got to think about ischemic colitis. Another patient, right upper quadrant pain. There's air in the common duct. There's also air in the gallbladder and dilated bowel. Now, if the patient had a recent procedure, you could say, okay, maybe that's why, but there's no recent procedure. And then you look down with the dilated bowel, there's a circumferential structure here, which is easier to see on the next study. It's a stone. Air in the biliary tree, air in the gallbladder, contracted gallbladder, and a stone in bowel. That's classic for gallstone ileus. Usually it obstructs in the terminal ileum, but it can obstruct proximal, which it was doing in this case. What a really good example. Remember, gallstone ileus, air in the biliary tree, in the gallbladder, intestinal obstruction, that biliary enteric fistula. Mortality rate, if not diagnosed, can be very high, and it's usually women, and the patients are elderly. What a great case. What about this case? Right lower quadrant pain, there's a cystic lesion here. It's cystic solid. Could be coming off the appendix, but then when you look, it's away from the appendix and cecum. So it's not going to be a mucocele of the appendix, a mucocele coming off the colon, too far down and away to be a Meckel's. This is really related to the small bowel. Solid, smooth, well-defined lesion off the small bowel, not causing obstruction. It's exophytic. That makes you think about an ileal gist tumor. And this was an ileal gist tumor, just about 5 centimeters in size. What about this case? Right upper quadrant pain. You see in the stomach there's thickening here in the antrum. Is that real? Well, you can see it on the volume rendered views, the asymmetric thickening. Remember, we make the point that you can be fooled in the antrum, you can have symmetric thickening, and it can be to 12 millimeters, but here it's asymmetric, particularly well shown on the sagittal view. It would be circumferential if it was symmetric. And this is an infiltrating process, which is an adenocarcinoma of the stomach. A really nice example. Elevated LFTs. Vascular lesion, dome of liver over 2 centimeters in a cirrhotic liver. Without looking any further, that's hepatoma till proven otherwise. There's some neovascularity nicely shown here. Here it is on cinematic, the mass, the neovascularity. No surprise, hepatoma. Really nice example with CR. Another case, GI bleed. There's a mass coming off the stomach. It's not the pancreas. My first thought is a gist tumor. Classic exophytic gastric gist tumors. When I quiz someone, I said it's not a gist tumor. What else? Well, it could be a retroperitoneal mass. It could be a mass off the pancreas. But one of the things we're seeing a lot of is metastatic melanoma. It can look exactly like a gist tumor along the lesser curvature, large necrotic tumor, This was a metastatic melanoma, a really good case. What about this patient? Back pain, rule out this section. There's a large aortic aneurysm which has the look of an aneurysm about to rupture. It's irregular around there, but look at the spine. When you look closely, there's a discitis. So what you're dealing with here is an aneurysm, which is a mycotic aneurysm, causing erosion of bone at multiple levels, as well as an infectious discitis. A really, really classic case, beautifully shown on the bone images. Mycotic aneurysm with spinal osteomyelitis. Very classic. Usually E. coli, but can be many things from Klebsiella to TB. Neck swelling. Large cystic nodes, left supraclavicular zone. Again, you always think about lymphoma with left supraclavicular nodes. There's also cystic changes into the muscle. But if I tell you what else could it be besides lymphoma, you'll think hard and then you'll say infection. And then what infection gives you cystic nodes, and that's TB. TB classically can occur in the supraclavicular zone, in the mediastinum, but here it was exclusive in the supraclav region, simulating malignancy. Let's not forget about TB. Another case, mass, tail of pancreas, coarse calcification, slightly enhancing. Calcifications can be seen with mucinous cystic neoplasms, with SPEN tumors, with serous tumors. But when you have a mass with coarse calcifications and enhancement, I gotta be thinking about a neuroendocrine tumor. And this was nicely shown on the cinematic rendering as well. A neuroendocrine tumor with calcifications. Coarse calcifications, again, very common. Well, that's 10 cases, and it took about 10 minutes. Anyway, I hope those cases were enjoyable for you to look at. You can watch them again, think about them again. But that's all for today. I'm sorry. And I know I'll see you tomorrow and later today with everything else on CTisus. But for the quiz, this live in-person quiz, back to next month. But on the 1st of November, the next month's 10-question quiz with discussion is going to be available. So you'll see that. And I also want to thank everyone who voted for us, and people hopefully will continue. Our app on CR of the Chest is the finalist, one of the 2 finalists, and Ann Mini. So we'll see. But with that, I wish everybody a great day.